Welcome back to Educator.com. This is a lesson on the axial skeleton. The axial skeleton is the part of the skeleton that's along your axis. So AXIS, just like the axis of the Earth, just down the middle. This is the middle of your body, so every bone that's in that section is considered part of it. So of course that includes the skull, all the bones involved with that, the hyoid bone, one of the ones most people don't know about right here, the vertebral column, also known as the spine, and the thoracic cage, also known as the rib cage. So we're going to start with the skull at the most superior portion of the axial skeleton. The cranium is all of this business right in here. And that includes the frontal bone, the parietal bones, the temporal bones, the occipital bone. You can see we have a sagittal cross-section straight through the skull here. There are two other bones that are associated with the cranium. They're forgotten often. That's the sphenoid, which is right here, and the ethmoid bone, which makes up a lot of the nasal cavity. That's in here. So they do articulate with those other cranial bones. They form at least a part of the cranial cavity, so they're considered part of the cranium as well. The frontal bone, right in the front, includes two major parts I want to mention. The sinuses. Sinuses are hollow cavities within bone. The two frontal sinuses are approximately here. And sinuses serve a couple purposes. One of them is these hollow portions within the bone make the bone weigh less. It has slightly less mass. If all of the sinuses, the 8 cavities in our skull, were filled in with bone, our skull would be a little bit heavier. And if that was the case, maybe we'd be used to it. But having that slightly hollow area does reduce the weight of the bone. And also, you within those cavities have mucous membranes that can create secretions for the sake of catching bacteria and viruses before they spread deeper into more vulnerable organs within the body. So actually some of the cavities or sinuses that we're going to talk about in this skull section of the lesson, they do connect to the nasal cavity in terms of producing mucus and helping to clean out that area. So if you ever get a headache that you just feel right here, it could be because you have swelling within the sinuses of your frontal bone. Sutures. Sutures are those immovable joints that connect a bone to another bone. So you do have sutures that connect the frontal bone to the parietal bones on the sides. You have sutures right here that connect the frontal bone to the maxillae, the nasal bones, which we'll get to later. And so part of the frontal bone does form part of the orbit of the eye. The orbit of the eye would be the giant eye holes that you see in a skull. That's the frontal bone. Next up, the parietal bones. And you can see there is a major suture right here. This is just simply called the sagittal suture. I'm not going to draw that the whole way down, but that connects the two parietal bones to each other. You can see also there is a suture right here connecting it to the frontal bone. So the two parietal bones together, the most superior and lateral cranial bones in the entire skull, because they're right up here on the top, and you can see the little bulges on the side. This part of the skull right here is the most to the side of any other part of the head. You can see that I don't list sinuses here. There aren't any major sinuses in the parietal bones, but something else that's of interest before I move on is the fontanelles. The word fontanelle generally is associated with infants. Those soft spots of the baby's head that you're supposed to be careful with. When a baby comes out, you want the skull to be slightly flexible so that they can get through the birth canal properly, and also to allow for lots of brain growth that happens in the first several years of life. In my skull, there are no more fontanelles. Those soft spots have now been filled in with hard bone, and there are full-on immovable sutures. Those fontanelles in a baby's skull, those are soft spots that you're going to see where the sutures will one day be when they're full grown. The temporal bones, next to the temples of your head. There are several interesting things coming out of the temporal bone that are a very important part of its shape that I want to cover with you. First off, the zygomatic process. That's right here. And so that does connect to what's called the zygomatic bone. So this is not part of the temporal bone. This cheekbone is called the zygomaticus. But if you follow it back here, where you have some muscle attachment for your jaw, right here, this is the most, I guess you could say, anterior part of the temporal bone. And there's an immovable suture, a connection to the cheekbone there. The external auditory meatus, also called the external acoustic meatus, is your ear hole. Here it is. So yeah, you've got the actual auricle or pinna of the ear right here, but the hole is really in the bone as well. And so that's leading to the inner ear. The mastoid process is this little bulge right here. And you can barely feel it. If you go behind the ear, I'm feeling it right now. There is a little bump that comes right next to the lobe, and you have a lot of attachment of neck muscles there. Very important for moving your head around. Next up, the styloid process. Gonna do that one in yellow. That's right here. And on a lot of skulls I've seen, or even models, that part will easily break off if people aren't careful. So I've had skulls in classrooms before where there's no more styloid process. But that, I can't have you feel it. It's too deep. You can't possibly feel it. Don't try. You have that connected to parts of your throat and your tongue. So that's the reason why you can't touch it. The mandibular fossa. A fossa is a term for any time you have a kind of well that something else fits into. This is the mandible, which we'll cover towards the end of this lesson. The tops of this bone fit in very nicely to a part of the temporal bone. And it's hard for me to label it there because it's kind of tucked underneath. But next to the mastoid processes, you have these mandibular fossae. Fossae would be plural if we added an E to the word fossa. And so you have these little condyles, these little bony projections of the jawbone fitting very nicely in there. And so those are the mandibular fossae on either side of the skull, because you do have two temporal bones. And one of the other ones I want to mention is the carotid canals. The carotid canals, those are hard to see from this particular image, but the carotid arteries that feed your brain with blood every second of every day, they go through the temporal bones to get up to the brain. The occipital bone. If you flip a skull up, as we're seeing in this image here, you have to look on the bottom to see it, but it's also in the back. The occipital bone does come up here, but the majority of it is tucked under. This giant hole here is called the foramen magnum. Magnum meaning large. Foramen is a fancy anatomical word for a hole in a bone. And plural would be foramina. You don't use the word foramens, that doesn't exist, but if we want to talk about numerous of these things, you would say foramina. But you just have one giant hole there, and you can probably guess what comes out of it. The brain stem leading to the spinal cord comes through that particular passageway. The occipital condyle. On the occipital bone, you do have these two parts that kind of jut out next to the foramen magnum, and the first vertebra, the top bone of your vertebral column, fits quite nicely with those condyles. And so it's called the atlas. We'll cover that later, but the atlas fits perfectly into those occipital condyles. And lastly, the jugular foramina. Tough to see here in this particular image, but the jugular foramina are two holes that the jugular veins come out of. So the carotid arteries, which we mentioned in the temporal bone slide, those feed the brain with blood, and the veins coming out of your cranial cavity, the jugular foramina, they hold the jugular veins coming out, going down the neck, and connecting back to the heart through the vena cava. Next, the sphenoid bone. We're getting towards the end of the cranial section of this presentation, but I like to nickname this the bat bone. Sphenoid. It looks like a bat to me. If you look at this particular image, we're looking straight through the back of the skull. You can see how it kind of has these wings. It looks almost like a bat. So it forms part of the inferior portion of the cranium. That sagittal cross-section we saw, it was towards the bottom/front anterior portion of the cranial cavity. And it connects the cranium to the facial bones. A lot of facial bones that we'll cover a little bit later in this lesson articulate with the sphenoid. So straight back through the eyes and nasal region, that's where the the sphenoid bone is located. There's actually a pair of sinuses in here too. These sinuses produce mucus that helps drain into the nasal cavity to clear out some of the bacteria and viruses that you can be inhaling through that region. More on the sphenoid bone. The sella turcica is a little well, and there was actually another image we saw earlier where the sphenoid from the side looked like it had this little well, almost like a saddle. And actually, sella turcica means Turkish saddle. And if you're wondering, what's the cowboy riding in that saddle? It's the pituitary gland, which we'll cover later with the endocrine system. But that's where the pituitary gland is found. If we cut this in half, you'll be able to see that. And there's actually an image later on in the lesson where it's a bit more visible. The optic canals. The optic canals are for the optic nerves. So remember I said that the sphenoid is behind the eyes. So the optic nerves that come out from the posterior portion of the eyes, they go through the optic canals on their way to the back of the brain in the occipital lobe. And then there's greater and lesser wings. The greater wings are these big ones here. And the lesser wings are these tinier little extensions. Here's a superior view of the cranium interior. So if we actually remove the parietal bones and kind of keep the rest, you can see how it all kind of fits in. The one we haven't covered is the ethmoid. That's coming up in a bit. But here you can see those wings of the sphenoid, the lesser wings here. You can see how the temporal bones on either side fit in or articulate with that sphenoidal bone. And the frontal bone has its own sutures connecting to it as well. So what is this ethmoid bone? This is the final part that actually articulates with the cranium. It forms the superior portion or upper part of that nasal cavity and part of the septum. So the septum, we often refer to this part of the nose as the septum, and this is a skin/cartilage portion of the septum. But if you go back further, there is a bony septum, a bony separation between the two sides of the nasal cavity. And also part of the cranial floor. In that previous image, you remember seeing the ethmoid made up a part of that interior of the cranium. And ever so slightly, part of the orbit of the eye is thanks to the sides of the ethmoid. So here are two images from Gray's Anatomy. This particular one, we're looking posteriorly at this particular ethmoid bone. It contains something called the crista galli. So what is this crista galli? The crista galli actually stands for coxcomb, like that part on a rooster, that very typical red hanging thing on a rooster's head. Someone who was looking at this named the little part of the ethmoid that's protruding up into the cranial cavity the crista galli, or coxcomb. And if you use your imagination, it's remindful of that little red thing poking out. But it barely protrudes into the cranial cavity. The nasal conchae, these sections all in here are nasal conchae. Conch, like from Lord of the Flies, that particular shell, that spiral shell, Conchae, it's these caverns that are all twisting, making up those nasal cavity bones. The perpendicular plate, this is in the very middle of the ethmoid, protruding down. This is that bony septum, the majority of it, straight back through here. And there's also two ethmoid sinuses, two cavities within this bone that help drain out that nasal cavity. Now we're moving on to the facial bones. The maxillae are two bones. Each one's called a maxilla. Here's a suture right here. But you can see that this is a very peculiar shape compared to the other bones. So each one is a maxilla. You can see that they hold the upper teeth, form the inferior portion of the orbit right here, the bottom part of it, and make up the upper jaw and the hard palate. There is a soft palate that is more posterior, further back. We'll get to that later. And the last set of sinuses are located in the maxillae. So that's a total of 8 sinuses in the skull for 4 pairs. The palatine bones, those do connect with the parts of the nasal cavity. It's kind of like goalposts. You can see that shape here from this particular view. There's 2 bones that fit in. You've got the parts that are lateral right here that kind of hug the sides of the ethmoid bone, and then connected to the maxillae, which we just covered, right posterior to the maxilla, hard palate portion, you've got the palatine making up a part of the hard palate that's a little further back. Nasal cavity bones. Here's some more bones that are associated with all that twisting, turning stuff behind the fleshy cartilage nose. So the nasal bones, if you notice the bridge of the nose right up here, very hard. All of this in here, skin and cartilage. But right here, which has a lot to do with the shape of your nose, are 2 nasal bones. So when someone breaks their nose, chances are they're breaking nasal bones, possibly parts of the ethmoid deeper. But the only bones in the proper nose are right here. And there's 2 of them. Because of this sagittal cross-section, we're only seeing 1, but here is one of those nasal bones, and you can see it articulates with the frontal bone. The vomer, which we're going to see a little bit more clearly in a future image here, is right beneath the ethmoid and forms the most inferior part of that bony septum. And it's connected to the maxillae, but it's further back. And then finally, the inferior nasal conchae. Each one is a concha. If we look at the ethmoid bone as being that twisty turning bone with the perpendicular plate in the middle, here's that crista galli. If you tilt your head to the side, it kind of looks like an E. That's how I remember that that's the ethmoid, that the ethmoid looks like an E tilted. The inferior nasal conchae are these little units coming off the most inferior part of the ethmoid bone. So they're very tiny bones. They call them inferior nasal conchae because they're on the bottom part of it. Oh, and here is that sella turcica. You can see from this image a very clear view of that saddle where you would find the pituitary gland. And there's the sphenoidal sinus. Here's another great view, sagittal cross-section, where we can look at a lot of these bones we've gone over. You can see the temporal bone from inside the cranial cavity. Here's the sphenoid bone, once again, sella turcica, Turkish saddle, with the sinus. There's that vomer bone. Like I said, it articulates with the maxillae and the ethmoid bone, and when you have that perfect cross-section, you can see the vomer. The previous slide was probably a sagittal cross-section slightly to the side or slightly lateral. When it's perfectly medial like this, you'd be cutting right where the vomer bone is. A couple more facial bones. When we look at just this section of the skull, there's the maxilla again. Here's that cheekbone I mentioned earlier, the zygomatic bone. So it does articulate with, remember that zygomatic process of the temporal bone, but those cheekbones, which have a lot to do with the shape of your face, as well as the other skull bones, of course, they're called the zygomatic bones. And there's actually a muscle called the zygomaticus attaches right there. The lacrimal bones, they're not labeled on this drawing, but I'll show you where they are. Lacrimal bone, right there. Lacrimal, like the word lagrima in Spanish, which means tear, comes from the same Latin root. They're tucked into the sides here. You actually can't really touch them because they're on the sides of your eyeballs. They have that name because it helps drain tears from the eye area down into the nasal cavity. So this does connect into the nasal conchae through a little passageway there, and it's brilliant how that works. So some tears do emerge out of the eye down a cheek, but other tears can drain into that lacrimal bone passageway. And the mandible, the lower jaw bone. It contains the lower teeth, of course. The mandibular condyles are right here. Those do connect with the mandibular fossae. This particular process attaches to muscles that help with the particular movement that your jaw makes, whether you're talking or chewing or what have you. So if you do look at the mandibular fossae, it's a perfect fit for the mandibular condyles. One of the bones of the axial skeleton that's oftentimes forgotten is the hyoid bone. If you come up pretty high up on your throat, you can feel a very hard bony section above your larynx. So here's, that Adam's apple larynx section, but the hyoid bone is just above it, and you can see that. So here is that typical Adam's apple looking thing, which we'll cover later in the respiratory system chapter. But this is the hyoid bone. This is one of those unique bones in the human body that doesn't touch any other bones. That's rare. I mean, think about any bone in your body. It's articulating or making a joint with something else. This is connected to other bones via ligaments, but it's free floating. If you're wondering, well, what does it do? It helps with talking. It helps with swallowing. Your tongue is attached to it. So it's a very important bone, but not touching any other bones. The vertebral column, also known as the spine. There are 26 total bones in the average human body. 24 of them are just typical vertebrae. Vertebra would be singular, vertebrae is plural. And then at the bottom you have the sacrum and the coccyx. There are cartilaginous pads or cartilage pads called intervertebral discs between each of the vertebrae. And we'll see that a little bit better in future images. Those little pads are not only for cushioning, but it's how these bones are articulating with respect to one another. So every movement you make of your back, they're ever so slight movements of those bones with those cartilaginous pads. And you can see there are some major portions here, anatomical sections that are important to remember. The body of each one of these vertebrae is where that cartilaginous pad is. There's one on the top and one on the bottom. That helps it fit into the other ones above it and below it. Vertebral foramen, remember the word foramen means a hole, basically. And as you can probably guess, the spinal cord fits into the vertebral foramina. The spinous process, which is the most posterior part, the body would be the most anterior part, but the spinous process, the most posterior or dorsal part, is when someone bends over and you see those backbones, you're looking at the spinous processes. And sometimes they protrude slightly more on other people than others, but they attach a lot of back muscles. The transverse processes is the last one I'm going to mention. The transverse process, they say transverse because it comes out kind of horizontally, and that is where you have the ribs, the back of the ribs fitting into each of those backbones or vertebrae. And there's a little, a well or a fossa that fits very well with a little condyle, a little protruding part on the ribs. When you look at each of the vertebral curvatures, there's 4 major ones. There's the cervical, meaning neck, the thoracic, which has to do with your thoracic cage, the lumbar or lower back, and then finally the pelvic curvature, also known as the tailbone. There are 2 bones I wanted to show you from the cervical vertebrae, and you actually do have 7 neck vertebrae. They just say C1 through C7. And then once you get to T1, that's where the first rib is. That's why they have that separation. But I wanted to show you atlas and axis. Atlas is also known as C1, and this is also known as C2. So they're the top 2 or most superior parts of the cervical vertebrae. The atlas is named after that mythological figure Atlas, who you can see in images holding the entire world. And this is a clever name for C1 because the atlas vertebra is right under your skull, and that's connected to the occipital bone. I told you that there were those parts on the occipital bone that articulate with that first vertebra. They articulate with these 2 things here called the superior articular facets. And it's a clever name because that bone is holding up your world, which is all in your head. Right beneath that, fitting into part of this little foramen, you do have the axis. And that's a great name for it because the axis rotates so that your head can move back and forth. So the atlas will remain still against your skull, but the axis is kind of what it's rotating around. And then we look at the other sections, thoracic, lumbar. This is a typical thoracic vertebra, same image as the previous slide. This is where you're going to have significant transverse processes because you have to have ribs attached to it. So you do have 12 pairs of ribs, so there are 12 thoracic vertebrae. And like we said before, you've got this hole for the spinal cord going through it. When you compare the size of the hole here to the size of the hole in the average cervical vertebra, they can get a little bit smaller. Think of it this way. As your spinal cord goes down your back and you have nerves extending off of it, it's like taking traffic away from what's farther down or more inferior. So that the spinal cord gets slightly thinner as you go down. And finally, when you get to the lumbar vertebrae at the very bottom, proportionally it looks like a smaller hole compared to those bones. And it makes sense that also the body changes size. Look at the body on the cervical vertebrae, not nearly as much. There's slightly less weight to hold up there. But as you go farther down the vertebral column, more and more weight is being held there and supported there. So you're going to see the body size be significantly larger on the lumbar vertebrae. There are 5 lumbar vertebrae, and they're quite large compared to the ones that are superior to it. The pelvic curvature is that part of that tailbone at the bottom that's right in between the pelvis bones, which we'll cover more with the appendicular skeleton. So here's that vertebral column side view. You can see, like I said, the 7 cervical vertebrae, the 12 thoracic, the 5 lumbar, and then here's that pelvic curvature made up of 2 major bones. And yes, the backbones that we see when someone bends over, those are the spinous processes right there that you're going to be seeing along someone's back. And yeah, something like scoliosis would be obvious if you have someone bend over and you look along their back. If their spinous processes do not appear to be straight, they may have scoliosis. But you can see that these curvatures, 1, 2, 3, 4, it's very wavy. From the front and back, it should look straight, but from the side, these curvatures help give us our posture. And here's that pelvic curvature. The sacrum and coccyx. The coccyx is a very small portion of it. It's right here. And the rest of it is the sacrum. So right here, coccyx, the rest of it is the sacrum. The reason why I say here that the sacrum has 5 pieces and the coccyx usually has 4, When we're born, we have a lot more bones than we do as an adult. As an adult, we have 206 bones, and in some baby bodies, if you counted all of them, it'd be more like 300. A lot of these bones end up fusing together to make a smaller number as we age. So in an adult body, you would see the sacrum as one bone. You would see the coccyx as one bone, but it's a product of fusing together bones that were previously not connected directly. So the sacrum, if you count 1, 2, 3, 4, 5, there's the 5 pieces, and they're all fused together here. You can see it says at 25th year, at the age of 25. Here's a side view, a lateral view of the sacrum, and you can see this little surface here. That's where the pelvis or the ilium would fit into it. The reason why it says coccyx usually has 4 pieces is in some people, the coccyx is only 3 bones, in other people it's 5. But most of the time you would see 4 tiny bones making up that very, very most inferior part of the vertebral column. And the last part of the axial skeleton is the thoracic cage, also known as the rib cage. So you have 12 pairs of ribs. If you count all of them, there's 24. You can see how this top rib articulates with the first thoracic vertebra, or T1, that's why it's called T1, all the way down to T12. And then right here, where you don't have a rib anymore, that's the first lumbar vertebra on down to the pelvic curvature. Of course, you've got these 24 ribs connecting to the vertebrae and back of the thoracic curvature. And then what do they connect to in the front? It's called the sternum. So the breastbone or sternum has 3 main sections. The first one being the manubrium. So the manubrium, right up here, is the top part or most superior part. The very first pair of ribs connect to it, and also the clavicles or collarbones connect to it, which we'll cover more in the appendicular skeleton lesson. The body is the major part of the sternum, where a lot of ribs, their cartilage rather, is articulating with it. And that's the major part of the sternum that we're familiar with. And then finally, the xiphoid process. This little guy seems very insignificant, but there's a major application with CPR when it comes to this bone. If you take a CPR course on how to properly resuscitate and give compressions to somebody, they tell you that when you remove their outer garments and you look at their chest to find the proper spot to give compressions, they want you to find where the lowest ribs come together, then put 2 fingers there, and then place your palm above it. Because if you give compressions where the xiphoid process is, you could break it off pretty easily if you're giving compressions the right way, and you could puncture the person's lung or worse. And then you'd be doing them a disservice if you're trying to get them to come to and get their heartbeat going again. So they have you do the 2-finger rule so that the bottom of your palm is resting right about there. And that's going to be even closer to the heart and avoiding the xiphoid process breaking off. The costal cartilage, the last part that I wanted to tell you about, is all of this darker stuff. Even on real skeletons, when you look at them, if they're an actual authentic skeleton that's been cleaned and displayed, usually that part of the rib cage will be darker, and people say, why is that part brown? Well, it's not dried bone, it's not just regular bone that's been cleaned, it's dried cartilage, and that soft bone tends to kind of turn brownish. If it wasn't for that cartilage, we wouldn't be able to do this. So it just helps the thoracic cage expand and contract much more easily because of that soft bone. So the costal cartilage also applies to this other term that has to do with what I'm drawing here. These are known as the intercostal spaces because they're between the costal cartilages. And the intercostal space also applies to intercostal muscles. So those are the main muscles that are helping you actually expand your rib cage and relax your rib cage for the point of expanding and relaxing your lungs. And finally, I just wanted to point out these ribs at the bottom. There are actually a few ribs that do not come back and connect with costal cartilage. Those are called floating ribs. and it's tough to find them, but yeah, they do not come up and connect with these other ribs to the body of the sternum. Thank you for watching Educator.com.